What are some studies currently being carried out by IPSG?
Some of the first clinical studies that we've started through the IPSG are looking at kids who are presenting in the early stages of disease. And we are looking both at 6 to 8-year-olds, 8 to 11-year-olds, and kids who are over 11. The 6 to 8-year-old group in general we find somewhat confusing in that the two big studies that are out there in the literature have conflicting results. One study says that it makes no difference whether you operate or not, and the other study says that kids who are 6 to 8 years old benefit from surgery. And so but you could argue that maybe there aren't quite enough numbers in those studies to say that conclusively. And so one of our first studies is really looking at 6 to 8-year-olds and kids that are presenting in the early stages at that age and whether they benefit from surgery or not. Those patients are also undergoing a perfusion MRI. We'd like to get a better understanding of what that information means.
More recently, we started a study looking at children who presented later in the disease process, so after the femoral head has either flattened out or become misshapen. We think that about 50 to 60% of the patients present that way, so it's probably more the majority than the early stage. So the question is, can we help those kids improve their outcomes long term? So by separating those children out, we're trying to look at whether we can improve the shape of that femoral head at maturity through operative treatment or non-operative treatment. So we're going to compare those two big groups. The big difference between this prospective study or looking forward compared to the older ones is they kind of mixed in children that presented early and children that presented late. So we're trying to tease it out a little bit more so we can really fine-tune who improves with treatment or is benefits by being treated and decrease the amount of over-treatment that we provide children.